This is a very precarious and dangerous time, and I'm worried about an unraveling of our vaccine ecosystem. Hello, this is Dr. Peter Hotez, a vaccine pediatrician scientist. I develop vaccines, but also advocate for vaccines as both vaccine scientist and parent of an adult daughter with autism and intellectual disabilities. Because if you remember, the original false assertion against vaccines was that vaccines cause autism. And we have now massive evidence showing there's no link between vaccines and autism, but also abundant evidence that autism occurs in early fetal brain development through the action of autism genes. So if there is any environmental impact, it's due to exposures during early pregnancy. And I'm concerned that despite all of this, that our current Health and Human Services Secretary is proposing to reopen looking at links between vaccines and autism, despite the massive evidence to the contrary. So this is a very precarious and dangerous time, and I'm worried about an unraveling of our vaccine ecosystem.
I'm Angie Rasmussen. I'm a virologist at the University of Saskatchewan. To me, the most troubling thing that's happened so far in this administration is the attempt to reduce the indirect cost rate to a flat rate of 15% across the board. This will have an effect of essentially shutting down all academic research that's occurring in the U.S., as well as any institution in a foreign country that is receiving NIH funding.
Trump administration has frozen tens of millions of dollars in funding to Title X clinics, preventing them from serving low-income folks with family planning services. At the end of March, nearly 1 in 5 grantees received notice that their funding was frozen, with all of the Planned Parenthood clinics in the program affected. Every day this is not resolved, our patients are losing critical access to reproductive health care services.
Hi, I'm Nahid Bedalia. I'm an infectious diseases physician. I run the BU Center on Emerging Infectious Diseases. One of the things that concerns me the most in the first 100 days of this administration is the executive order on foreign aid that's putting a 90-day pause, as well as the 83% cut to the USAID budget. This budget supported incredibly important programs, not just for emerging pathogens, but for endemic diseases like tuberculosis. For example, we know that if tuberculosis treatment and diagnostics programs are not restarted, then over the next 5 years, according to calculations by Professor Brooke Nichols here, we'd see 10 million new TB infections or 2 million new deaths. I believe that we need to focus on why our destiny is tied in terms of keeping the global community safe by making sure that we can pick up a signal from the noise by ensuring that health systems around the world are not overwhelmed with just endemic infections.
My name is Craig Spencer, and I'm an emergency physician and public health professional at Brown University. In just over 100 days, we've seen the Trump administration completely dismantle the disease detection architecture that we've built up over decades and rely on to keep ourselves and the rest of the world safe from infectious threats. We've seen how programs to address and respond to things like Ebola have been torn apart in this administration's attempt to cut costs and to cut our global health leadership. As things stand, we remain unbelievably exposed in a way that we haven't in a very long time to things like Ebola and other infectious threats. From getting on a plane somewhere else and showing up in this country where our own disease detection systems and our own capacity, vital public health activities here in this country have been undermined and under-supported.